Hi. So let's get to know what is a coronavirus and what is this novel coronavirus and what is all there to know about for the common person. So basically, coronavirus is a group of viruses which are usually found in animals, and they usually don't come around to human beings. But it turns out that in rare occasions where there's a spillover event, it's called a spillover event, where humans interact with these animals and they catch on this infection, and in turn what happens is the humans, they transmit it to each other. So the first time recently when it happened was in 2003, when we all heard about China, where the SARS virus had started in an epidemic. So that was severe acute respiratory syndrome virus. So that was also a type of coronavirus. So why is it called a coronavirus? It's just because of its structure. Basically, it has something like a crown in it, which is made up of some molecules. So that's why it's called coronavirus. Corona means crown. So these group of viruses, the other group was in 2009, when there was something called Middle East respiratory syndrome virus. So that happened in Saudi Arabia, and it started from camels. So from camels the humans got it, and the one in China 2009, it probably started from cats. So similarly, this time in the city of Wuhan, this virus, the novel coronavirus, has been transferred to humans from livestock, but we don't know which is the cause of which is the organism which has started this, which animal. Some people say it's from snakes, some of them say it's from bats, but we actually don't know that yet. And research is going on. The whole sequence of genome of this virus has been mapped up already, and people are already working on how to limit the impact of this virus on human beings and to prevent spread, get a vaccine and all that. So the WHO has told that the fatality rate of this novel coronavirus is actually somewhat lesser than SARS, which was a few years back. This established case fatality rate or mortality rate we'll get to know only later, because initially they said it's a very mortal virus. That is because people started noticing this virus only when people died, and those cases only came to attention. So nobody knew who are the patients who got this virus infected, but they didn't have any symptoms. So silent carriers, that's what they're called. So nobody knew which are those patients. So later on they found out that the case fatality rate is 9%, and then it dropped to 6%. So when they find out that more and more patients who get infected don't develop symptoms, and some of them develop only fever, some of them develop only mild cough and cold, only a less number of patients who get the severe form of the disease, where they have acute respiratory distress, pneumonia, and then the more severe form is where they get kidney failure, liver failure, and death. So the real case fatality rate we'll know only later, but basically there is nothing to panic, because basically if we follow the rules of personal hygiene and take some precautions, then the major damage can be averted. So how can that be done is that avoid going to places which are crowded. So this is not only now but always, because it's not good to be in a place which is crowded and jam-packed. There is no place to breathe. So, and try to get fresh air as much as possible, and wash your hands whenever you touch somebody, shake hands with somebody, especially when you know that you feel that the person might be having sneezing a lot or something like that. and basically try to wash your hands every now and then. And if at all you are feeling sick and you have a fever or something, don't go out and mingle with others. Try to take some medicines and see. And if you feel that something is not normal, then go and meet a doctor as soon as possible. And these are just general precautions. There are 3 cases recorded in India and Kerala, but they're all contained, and those patients are recovering well as of now. And this is an evolving virus, so more information we are getting to know each and every day. The other thing that you can do is you can take vitamin C, multivitamin supplements to keep your immunity level high. And in case you are a wheezer or somebody who's got asthma, in that case you should be ready with your medicines. And because this virus aggravates the condition of the lungs. If there is a pre-existing condition in the lungs like asthma, allergy, wheezing, in that case you should be extra cautious. And elderly and young people and who have these pre-existing conditions of the lung like asthma, allergy, wheezing, they should be more careful. And if you're eating meat, make sure the food is properly cooked and hygienic. Only in that case you please consume meat products and animal products. And always, if at all you are in close proximity with somebody who deals with animals, then wash your hands. And whenever you sneeze, use a handkerchief or sneeze into your elbow. That will prevent spread of any infection to others, not just coronavirus, but generally speaking, all flu viruses are basically the same. And more updates, you can subscribe to this channel. Thank you.